Hi, welcome to Naptime Nutrition. I'm Yaffi Lvova, registered dietitian of Baby Bloom Nutrition and Toddler Test Kitchen. I'm very excited today to have Jimmy Gialelis on with me talking about infant massage. Jimmy is an a massage expert, hopefully an infant expert too. But he not only does massage, but teaches it. And so we're going to talk today about infant massage and why it's beneficial and how can you start and how do you know if it's working and all that. So thank you so much for joining me, Jimmy.
I appreciate being here. Thank you so much for having me. And it's been fun to be a massage therapist for 20 years and going strong. And many of my clientels are very young. The youngest client I've ever had was only 3 weeks old.
Very nice. Yeah, and I actually consulted with some other baby massage experts when I had my own kids, and they were having a lot of intestinal gas, and even the doctors were talking about surgery on an umbilical hernia. And anyway, there we jump to a lot of drastic things, and I've done naptime nutritions on elimination diets for infant comfort for their intestines. But the thing is that we shouldn't start with diet with that. The thing is that kids fresh out of the womb, there are other things you can do with them. And a lot of times massage is at the top of the list for me when I'm advising someone who's got an uncomfortable baby. Massage is at the top because not only is that skin to skin contact that's helping the baby develop, but also there are certain massage techniques that can ease the discomfort while encouraging development of the intestines, which prevents future discomfort. So
Very true. Very
let's
true.
just start with that. So when is massage indicated with an infant? When would you know that we should start with that?
I think that's a really interesting question because usually the people that I see in my practice have clinical conditions. So I have worked with infants that had depressed reflexes. For example, the Moro reflex or tonic neck reflex or Babinski reflex were not as apparent. So we do massage therapy to enhance those reflexes. Or torticollis. So I think it's really easy to first say if a baby has some sort of clinical condition, a tongue tie, torticollis, something similar to that, feeding problems, we certainly know that at any point we can start offering infant massage as well as infant cranial sacral therapy. I find I combine massage, true massage, which is kind of defined as the idea of effleurage upon a body, massage strokes upon the body. There's also cranial sacral therapy, which is used to manipulate the bones, the cranial bones and spinal bones and sacrum as well. So it's interesting to note how we could certainly use this for clinical cases, but I think at any point, massage is going to be healthy for the infant because the biggest benefit I have discovered is increased bonding with the parents. I love that when I work with parents and such, I encourage them to be in the room, of course, and participate actively. I'll have a parent lay on the massage table with their child so that they can kind of also work along with me, and just that bonding experience becomes really powerful for an infant. I'm really cognizant to recognize that I want the baby to be really present with the parent, not necessarily with me per se. I want them to really create that great bond with the parent. So I encourage mom or dad or whoever to be on the table and really participate with me.
That's amazing. And the truth is that a lot of times when we're preparing to have a baby, we have all these ideas of what we're going to do. And then you have this infant who can't walk and can't talk and basically eats, sleeps, and poops. And it can be difficult to come up with ways to bond with that child or to come up with ideas. What can I do with this child? And especially right now, we're filming this during the COVID pandemic. A lot of options for infant classes are not either available or a smart decision. And so massage is a fantastic way to fill time while bonding with your baby. And even if there is no clinical reason to do it, if there is no torticollis, as you mentioned, which is the neck being a little bit kinked, the muscles can be tight on one side, either due to the birth or positioning in the womb, or other examples. This is not my expertise, but even if there isn't a solid reason why massage is beneficial, you still have that bonding with the baby. And especially right now, when we as new mothers feel so isolated, being unable to contact our tribe, we might really need more resources as far as bonding with our babies. And this is a fantastic this is a fantastic way to bond with the baby.
It sure is. And I think that also there's a great benefit of me as a parent being able to offer this to my child. It gives me a great deal of confidence. And speaking from the kind of father perspective, I know I still haven't seen the fatherhood game book here for parenting. I haven't seen that yet. So again, it can be very powerful for someone who may feel powerless to have a simple tool called massage to be able to say, well, if I can't do what mom can do, at least I can do something.
That's a very important point, and not one that I've thought about much, being the mom in the relationship. But it's really important to talk about that. And a lot of times that angle comes up when we talk about breastfeeding versus bottle feeding and involving the father. And sometimes that conversation can go sideways. But with massage, that is certainly something that has no controversy attached to it, that any father can do, any mother can do, any grandparent can do. That's a wonderful way to bond with the baby.
Indeed, indeed. And because as we do this, I think it's very healthy to make mention of what can make a massage effective. Really, ultimately, it's about connection. With infants, with anyone really that we touch, it really is about making a connection. And as we make a connection, we remember that the body heals itself. We simply facilitate healing. So I don't necessarily have to have fancy letters after my name. If I can connect with a fellow human being, healing will occur. I want everyone hearing that to really get that point, that you don't have to have gone to fancy massage schools. Anyone out there who has just a genuine desire to heal can place their hands in warm, loving ways and be able to facilitate the healing because the body heals itself. And that's something that babies can do so very adeptly is facilitate their own healing processes.
That's a really great concept to introduce, because and that comes up a lot when we talk about feeding children. And
Mm,
the thing is that when you're feeding an infant, when you're feeding a small child, they haven't had the influence of the outside world. They're not concerned about their body size and what this is going to do to their figure. And I mean, I've done nap time nutritions on that. That's a whole other conversation. But it's the same. They're so in touch with their internal perspectives. They're so in touch with their hunger and their fullness that when they're eating, they're naturally eating and they know when to start and when to stop. And so the concept you're introducing here is that it's the same with other types of healing, that they're so in touch with their biological perspectives. They don't have that psychology that's getting in the way, that's telling them how they should be feeling or how they should be reacting. So they
right.
are just receiving that loving touch and responding in a biological way, as well as a psychological way, in a positive manner. And that's just so powerful.
Yeah, and for all of time, we've known ancient cultures have presented this idea that we can help a new mother who's just given birth. In fact, I love when I hear about villages and tribes that ensure that the new mother, can rest comfortably in the home for several weeks, even months, and just tend to herself and the baby, while other tribes people and other just family members, whoever can come into the house, tend to family matters. And I hope that one day we can embrace that more in our culture as well. And then part of that is massage.
Yeah, I really agree with that. And to bring it to a personal place, after I had my twins, I had a lot of postpartum depression and anxiety. And people were telling me, you have to get out of the house, go have a coffee. Coffee was never my thing. Go sit at Starbucks. I don't really like Starbucks. But people were telling me that me trying to hibernate was a sign of depression and anxiety, when the truth is I found out later that even in my own culture, there is a tradition of the woman staying in the home for 40 days after the birth. And had I known that, that would have been really empowering. And so
Yeah.
anytime that point comes up, I love to say this happens around the world. As you mentioned, multiple cultures, every area of the globe, there is a time for a woman to rest at home, and that's fine. And on the other side, if you feel the inclination as a new parent to get out and to do things and to see people, that's also fine. But if you want to be home and relaxing and resting, that's a valid decision, and that is backed up by thousands of years of different cultures encouraging that. So whatever it is that you're feeling is right for you is right for you.
Indeed, very well said. I love that, and I think that's very healthy to kind of lead into kind of the biggest benefit that I've witnessed on a physiological level with working with infants. I have a studio here in Tempe, Arizona, and I've been working over the years with the Arizona Breastfeeding Center here in Tempe, and they certainly have provided me some clients in their way. But I remember working with many children, and something that surprised me when working with infants and children were the abdominal benefits, the decrease in colic, the decrease in anxiety witnessed at the core of the body, just sensing distension disappear, sensing calm and ease in the abdominal core. In fact, it's been interesting to note how when a child dictates that they feel anxious or kind of like maybe a tummy ache idea, that's their way of expressing anxiety. They may not have the vocabulary to say, I feel anxiety over this situation, but my tummy hurts. And when
Oh
my
yeah.
tummy hurts, I don't know why. The child may not be able to tell you why or where exactly, but really that's a big sign that perhaps there was some anxiety held in the body. So I find
Right.
that working the abdomen and connection, just in a regular massage setting, is so powerful to help children and infants ease any symptoms of anxiety.
Yeah, I can actually relate to that one as well. One of my kids really had a lot of anxiety and it was communicated through tummy aches. And when they're that little, they can't differentiate. I mean, it is a physical feeling to them, but there is no biological etiology, no biological root to that tummy ache. And when a child says they have a tummy ache, it could mean a million different things, but sometimes it really does indicate anxiety. And that was the case in my family. I ended up bringing the child to a urologist to be checked out. And even just that visit, acknowledging that we recognized that the tummy ache was real, eased that. And we really haven't had an issue since then. So it's really amazing how that can happen. So anxiety can really massage can help with anxiety. We know that as adults. That also works for small children and that also works for infants. The change from being in the womb to being on the world side of life is very jarring. And
Yes.
and sometimes we can see signs of anxiety in infants, and doing massage can really help with that. I also like to encourage baby wearing. And if anyone
Yes.
is looking into that, Baby Wearing International is now defunct, but they do have local chapters. And if you go to tandemtrouble.com, that's my good friend and colleague, Lakita Kemp, and she specializes in twin baby wearing. And she's got
Mhm.
tutorials there as well. But massage is just, it's something that you can do. It's puts the power in the parents' hands, literally.
Yes, literally, and I just think it's interesting. It's very simple in many ways, as long as you remember that if I do a massage on your adult body for 1 hour, I don't have to work a child's body for an hour. Again, smaller body doesn't need as much time, so I can work a typical session for a child for about 30 minutes. For an infant, 20 minutes is all we need. And out of that 20 minutes, if it's only 15 minutes of actual touch, that's okay because, again, we've made already a big impact. I just love to remember that the infant body is about 90% water. Maybe that's why they feel so soft and squishy, right? But 90% water, whereas our adult bodies are more closer to 67% water. So just knowing that the infant body is more water, if we just simply do some simple strokes from the wrist up towards the elbow a few times, a few strokes from the elbow up to the shoulder. It doesn't take a lot of effort. Just maybe use your hands and, like I would say, a Barbie hand or a Ken doll hand or Lego hand, like those dolls. Really, if you do that kind of hold and just do kind of a nice little squeezing motion, a soft squeezing, imagining that you're pushing the water through, like if you were wringing out a sock from the washing machine. That's all we really need to do as far as pressure on an infant. Doesn't Certainly there's no deep tissue for infants. There's only a kind of a pushing fluid through kind of movement. And if that is all it is, that's all it needs to be.
So, are there any movements that parents should specifically avoid when massaging their infant? I mean, you just mentioned pressure, and I think it was great the way that you described that. It was very clear. But as far as motions, anything specific to avoid?
I think we need to be mindful that the spinal column can already be very, very mobile. So there's no need to do a lot of movements of the spinal column. I would never try to twist a back of an infant. Again, there's no need to do that. The ligamental structure is not very, very strong yet, so there's no need to try to create fancy massage stretches for the back. I'm not sure if anyone out there is familiar with Thai massage, but that can get pretty fancy. There's no Thai massage for infants needed. But so if you do any movements, certainly movements of the arms and legs are okay, just to kind of create some healthy movements. I like to do some nice rotational movements of the shoulder and of the legs, and I encourage the parents to do this at home as well. Just every day, take the child's arm, create small circles, and make them even bigger and bigger. But there's no need to start big with your circles. Always start small with any movements, and from there we then get progressively bigger, but at some point we can recognize that the arm can't go any farther. No need to ever push the limbs any farther than their body will naturally allow. I would also avoid neck stretching. There's just no need to stretch the neck. In essence, the neck is an extension of the spine. There's a cervical piece of the spine that is the neck in essence. So really, when I say spinal manipulation, there's no need for the neck as well. I'll let a licensed chiropractor handle that, which I have to make a quick mention here. You know, in Arizona, massage therapists, certainly we are licensed to do what we do. Chiropractors are licensed to do what we do. There is another kind of a practitioner term called a myopractor. I'm not sure if you've heard of that particular term. Yeah,
I've heard of it once or twice.
Yeah, there's no licensure for myopractic. Just letting you know, there's no licensure. So again, I'm just kind of giving a kind of a buyer beware idea that if you go see a chiropractor, there's no formal licensure. So I just want to put that out there that massage therapists are licensed, chiropractors are licensed, and we've gone to formal training for what we do.
Right. It's interesting because dietitians in Arizona are not licensed. So
Mm.
I am technically not licensed. However, I am registered with the National Registry. And for us, it's very political. It has nothing to do with our education or our experience or our supervision. It has to do entirely with politics. And that's not the same with other professions. But I think it's good to know the background of the profession so that you can ask the right questions. Because regardless of whether you're seeing a chiropractor or a dietitian or a nutritionist, I've done nap time nutrition on that too, differentiating between different nutrition professionals. It's important to ask questions about where the person went to school, etc. So
Indeed,
that's a
indeed.
good thing to bring up.
And then certainly, again, when it comes to more specifically your question, again, what to avoiding spinal manipulations, avoiding neck manipulations. Generally, you want to keep strokes moving from distal to proximal, which would then mean from the elbow to the shoulder, as well as the wrist to the elbow, start from the knee to the hip, ankle to the knee. Keep them distal to proximal. If you start going in reverse, you can start reversing blood and lymphatic circulation, and that's not ideal. We don't want to reverse circulation as much as we can.
Right. So that's the arms and the legs. What about when you're doing stomach massage? We talked a little before about using massage for constipation or for relaxation or just for bonding. But when a lot of people ask about it specifically for colic symptoms or for constipation, so what do you do with the abdomen?
I would do a soft sinking motion into the tissues and then move in a superior direction, which is then towards the chest. So when it comes to that kind of technique, that's really trying to involve the lymphatics of the body. When I involve lymphatics, I'm trying to move waste through the body. Lymphatic tissue, lymphatic fluid is essentially carrying waste. So this idea of moving up the body, so to say, is really important concept when I'm above the belly button. So I'll use my belly button as the model example here. So my belly button, certainly if I were to any of that particular guided movement in and upwards, I'm moving up towards the chest. If I go to the umbilicus or belly button and go below the belly button, I'm going to try to guide the tissue in and down towards the hips, towards what they call the inguinal or groin region. I'm guiding more lymphatic fluid towards the inguinal lymph nodes, the groin area, so the body can process the lymph and take it to where it needs to go.
That is very interesting. What I've always been told is to just do a a clockwise motion or counterclockwise motion, and that's not what you're advising here. So that's interesting to learn something new.
And so the clockwise, counterclockwise, that was something that we taught in massage schools for comfort. It feels good, certainly. So not wrong per se. It's more accomplishing what we used to teach 10 years ago in massage school. The colon is actually way out on the side body. The colon is not in the very front anterior. So if I start doing small, circular motions on the very front top belly, that feels good. I'm just not impacting digestion as much as I thought I taught 10 years ago. The colon is off to the side, kind of like underneath the rib cage. So I would have to come almost like where if your listeners are kind of can touch the seam on their shirt, it's way out on the side. So if I do anything to help with digestion, I'm going to take my fingertips and give small circular motions or small pressing in motions, like I'm trying to be like my Chicago DJ days growing up here. Doom, 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 small pressing motions like so, yo. Or some small circles. I grew up in Chicago, that's why I say that. But some small circles there. Then I can start to stimulate the colon. As I stimulate the colon, that can certainly facilitate healthy elimination.
Amazing. So how can you tell if your baby is comfortable with it? If the kid's okay with what you're doing?
That goes back to reflexes. The infants will be able to provide us good reflex information here. One I like to talk about is the moral reflex. Moral reflex, also called that startle reflex. The body will react, and sometimes the body, just because the body seems startled, that's actually a good thing for a baby to indicate. If the baby did not indicate that startle moral reflex, then I would actually be more concerned about the neurological aspects of health. So seeing a very healthy moral reflex, where in a sense the head may turn, arms extended, then arms come back, that can be a really great sign that the baby's responding. Another good reflex we can make mention of is the root reflex. Root reflex, almost like that reaching out for breast tissue and for feeding and such. The root reflex, again, to begin feeding. So any sort of indication neurologically is a great sign that they're receiving this. So if the baby seems like they're getting active, that's a good thing. That's a really good thing. Again, that's a sign that they are responding well.
Nice. And of course, if they're crying, then maybe we'll try that again another time.
And I would say maybe to that. If they're crying, remember, babies certainly all they know how to do is cry in essence, and we as parents get to start to know: is this the hunger cry? Is it the poopy cry? Is it the I want attention cry? So I think if we have a cry that indicates like I like this attention or I want attention, let's keep doing it. Let's keep doing it here because chances are good that cry is going to become laughter pretty soon. If it is the hunger cry or the poopy cry, then again, then certainly we can cease at that point.
Yeah, I think that brings up a very good point. I've been talking a lot about how we are taught to not trust ourselves, and we're taught to not trust our bodies, to not trust our appetites, to not trust our instincts. And this is a great point that you're bringing up, that the parent needs to connect with their instincts because they are connected to that child. No matter how that child came to be part of their family, even in adoptive situations, you can connect with the child on that level and you can hear the child cry and close your eyes and breathe deeply and understand what that child is saying. You can do that. And when we've been receiving so many messages about how the messages that we hear and our instincts are invalid, it's good to come back and to take every opportunity to remind parents that their instincts are important. And when a child cries, we can think, what is this child communicating? And tap into that communication and understand it. It's not
Yeah,
100% of the time, but it's very common.
I do believe that intuition is the language of the soul. And as we follow our intuition, I really believe that we are really tapping into a message that is going to be true. And it gets me really able to connect better with my child.
That's amazing. That's a great point. Yeah.
Mm. If I
Wow.
can share some more, if I can share some more benefits,
Sure.
because I think already mentioned a few digestive issues can certainly be resolved. I think increased range of motion, especially if you have a child who seems like they're not exhibiting much movement, even having the parent just encourage movement. Like I said before, the encouraging the small circles, become bigger circles, encourage neck movement. I would maybe have a little toy that the baby can look at, maybe like a ringy toy, bell-like toy, just encouraging the baby to move their own neck. Move side to side, encourage that. And that's going to improve their range of motion as well. Developmental markers can actually be achieved swifter. It's interesting to note how infants who are touched more often in scientific research confirmed by the Touch Research Institute of the University of Miami, Florida, has indicated that developmental markers, how they begin to walk, how they begin to talk, things of that nature, can be improved and become achieved more swifter. That being said, it is important that a baby crawls before they walk. That's not a contest we necessarily need to win, because a baby has to have a strong psoas major muscle before they can start walking with a healthy gait. I'm being very careful with my wording because, again, gait is your manner of walk. Anyone can walk, but is your gait healthy? A baby needs to crawl enough. A baby has to crawl enough so that the psoas major becomes stronger. If that psoas major becomes stronger, they end up walking with greater ease, and their gait early on, right off the bat in life, is more healthier.
That is so interesting. So what about babies who scoot and they don't ever crawl? They just scoot on their butt and then walk.
Well, certainly, again, they're trying to strengthen the psoas major. So in that particular case, I would then, in the massage session, just take their little feet and start bringing knees to chest a lot. Knees to chest, work it, knees to chest, work it. I would do that a lot in session because it is important that the psoas major does get involved. If they're scooting around, that might be engaging more of the leg muscles, but those aren't quite strong enough yet. So really, we have to really encourage crawling if we can.
Right. Okay, so if I can offer a visual for the motion you just described, it was kind of like in Dumb and Dumber when he was trying to do the Heimlich. And
there you go. Yeah, something like that. Yes, there you go. I love it. Yes.
because you watch that in massage school, but you show that movie to your students, right?
I'm very sure we have, yes. Of course, improved sleep is the number one benefit parents might suggest is the greatest benefit of all. If we can get that child to sleep even 1 more hour, that makes a world of difference, doesn't it?
Yes, it does. Yes, it does.
Indeed. And of course, improved feeding and latching is really important. So certainly, especially if a baby's been born with tongue-tied, the procedures can be quite intense for the baby, even though they may not have the vocabulary to say it was intense and I feel pain in my hyoid muscles. In essence, the hyoid musculature has been affected. And those are 5 muscles in the upper throat area that are involved in speaking and swallowing. So there could be scar tissue that begins to form after any procedure along the jawline, along the TMJ region. So I think it's really healthy to recognize that, I mean, scar tissue is scar tissue. It's the same in your body as it would be in mine as in a 2-month-old. It has the ability to cause restrictions, literally restrict tissue. So even just some basic gentle touch, just in a simple way of just moving back and forth, and up and down. I like to think about making an asterisk sign. An asterisk sign, again, having the back and forth plus sign, plus the X added to it. There's your asterisk sign, Alt 8, I believe, on the computer. But again, when you make that asterisk sign, you really are able to engage the scar tissue in all directions. I don't have to push deep by any means. All I have to do is just use a finger pads with healthy intention. And as I just simply move the skin, I know the skin is attached to the fascia. Fascia is this fascinating tissue under the skin that it acts like saran wrap. So imagine if you had saran wrap that got really bunched up, saran wrap that gets kind of bunchy. You have to have a little finesse to undo it, right? You can't just brute force it and tear it open. Well, if you tear it open, that's not good, especially for the body. So you would just kind of finesse it. Like imagine that you're just trying to finesse saran wrap that got a little bunched up, trying to smooth out the tight saran wrap. That right there could undo much scar tissue.
And for anyone listening to the podcast and doesn't have the benefit of viewing what Jimmy is showing, he described the hyoid muscles, which are right down the front, the top of the throat. But what he's touching when describing the motion is the side of the throat, in between the very side and the front. So halfway between the center of the neck and the side, and you would do that on both sides.
Indeed, indeed. Now, some babies don't like that initially. I do admit there have been times that a baby's given me that reaction, and I simply then pause. I go back to another body part, and I try to bring myself back. I'll start very lateral to the side, try to touch the muscles I can, and try to work my way more medial or to the middle. We'll do our best, and if they don't receive it today, doesn't mean never. It just means not today. So I think that's
Right.
something that parents would benefit from hearing, is that just because a child doesn't like that particular technique today doesn't mean they'll never. It's just today, they're just not feeling it today, they don't like it today, but we do want to make the effort again in the future.
That also applies to different activities, and that also applies to different kinds of food.
That's right, exactly, very true, indeed. That's how we got our son to like broccoli.
Yes, well, it takes between 15 and 40 exposures for a kid to feel comfortable with something, and it would seem that with massage, it would take a number of exposures for a child to feel comfortable with a new way of being touched.
Indeed, indeed, very well said. I like that. Because we have to bring up one really important idea that, children, infants, they bring a certain sense of sensitivity and curiosity to your table, to your space. So in my infant massage classes and pediatric cranial sacral classes, I talk about how infants and children do bring a certain curiosity. So let's really speak about the idea of what that means. It means that babies will be very engaged and really curious in what we're doing. So let's ham it up. Like really ham it up, make it as silly as possible because they're really into what's happening. Again, they're just kind of wondering, what the heck is this? Is this going to be, pleasing or not? Is it going to be healthy or not for me? Am I going to like it or not? The brain is still figuring out its environment. So the more exposure, you're exactly right, the more exposure, the more that we kind of feed the curiosity and encourage the curiosity, then the more that those neuronal connections become very positive in the brain.
That's so interesting. There are so many themes. Every time I do an interview with someone who doesn't have anything to do with nutrition specifically, the same themes come up. When I've
Mhm.
talked about financial planning, it's the same themes. And when I've talked about massage, it's the same themes that come up. And it's just fascinating. So if we can start massaging infants right out of the gate, then maybe we can have these benefits that we're talking about directly, but we can also, as parents, practice that patience and practice that bonding and practice the concept that sometimes things don't go right the first time and we can try it again. There are a lot of themes that we can embrace through massage and through feeding and through financial planning and grocery budgeting that just, if we can understand the underlying themes that repeat themselves over and over throughout our parenting adventures, we can make parenting maybe a little bit easier on ourselves, right?
And I think that parents possess something that cannot be underscored enough. Again, I teach massage therapists, and I can teach a lot of technique. I can teach a lot of knowledge, but I can't teach how someone can care. I can't teach you how to care for a fellow human being. And that's where I think parents have the ultimate advantage, is that we genuinely have this loving, caring sense for our child. We can only do it right with love. You can only do it right with love. And I really want all parents to hear that again. You can only do it right with love. Because when we truly come from that space of love and service, we're going to do the right thing, and our child will feel that from us.
That's amazing. And I think that is wonderful for parents to hear a number of times. So I'm glad you repeated that. That's wonderful. So so where can parents find you, either virtually or in person?
Let's see. I know I work with the Arizona Breastfeeding Center. They can always contact that organization. My website is www.advancedmassagece.com. Also, my email is just my last name and first name at gmail.com, so I can give that to you. We can post that, I'm sure. I'm sure we got it on the Gmail we can post there.
Let's,
I
you
think
know
the
what?
website.
Your name is not that easy, being Greek. We talked about that before. I love studying cultures, but it's in the stream description, the spelling. So that's good.
So I think the website's just simply the best way.
Okay, great. Yeah, that'll be attached to all forms of this broadcast. Um,
Very good.
I think you gave some fantastic information, and we got deeper on certain concepts than I thought we would, and I think that's wonderful. So thank you so much, Jimmy, for joining me. I think this is a great conversation.
It's been a pleasure here, and I definitely encourage one more idea for parents is to really create an ambiance so that the baby enters that space for massage. Neurologically, they enter that zone, and the brain will recognize, oh, this is the time for massage. That's another way the baby can more easily receive this. Just like it was like in a massage setting for you, you walk into a room, the ambiance sets the mood, so to say. So you can certainly
Yeah.
do that. You can do that for a child as well. So again, treat that child as if they are like a client and give them the works.
So are you saying that parents should create a fascinating ambiance?
Yes, indeed, indeed. Lighting and all, right? Nice, with wonderful linens with their favorite blanket to lay on. Maybe some colorful lights. You know, we know party supply stores and such will have colorful lights. Maybe they might like an orange or a red light or purple light. They might like, you know, different kinds of scents. I find that infants really respond well to vanilla. So some sort of vanilla-like scent would be wonderful. Butterscotch, that sounds good too.
That
But
does
some
sound
sort of
good.
some sort of sense. And so certainly, you know, don't be afraid to play with the ambiance and the environment. Maybe turn the crib into a little mini massage center, and they can go almost like again be conditioned that when I'm on this blanket, when I see that purple light, yeah, it's massage time. It's fun time.
Yeah, that's a fantastic tip. And we can take that tip to make a mommy cave or a daddy cave as well. We can do the same thing for ourselves.
Indeed, indeed. Yeah. So
Yeah.
again, I'm located in Tempe. I know there's a lot of great infant massage instructors out there as well. I can always refer people to as well. But I definitely want to encourage people to look up the Touch Research Institute at the University of Miami, Florida. They have done decades worth of research on pediatric and infant massage and cranial sacral therapy, acupuncture, the works.
Amazing. It's always great to have more resources for reliable information for this. We were chatting just before we started on how massage seems like something that's very simple, so everyone's an expert. And it's the same as nutrition, that if you eat, you're an expert in nutrition. So it's always good to hear reliable resources where parents can go to find good information that will benefit them and their kids.
Indeed, very well said. So I've enjoyed our time together.
Thank you so much for joining me, Jimmy. And um, I hope that right now, it is December 21st of 2020. We are looking into a new year with optimism.
Mm-hmm. It's going to be a
Cautious
better year
optimism.
for sure. It's going to be a better year for sure. I have good feelings.
For sure. Okay, thank you so much.
My pleasure. Namaste.
Namaste.